Hi everyone, welcome back to Forward Therapy. My name is Kelly. I am a certified hand therapist, and today's video is for all the hand therapists out there or all the clinicians that are interested in hand therapy or clinicians that are going to be seeing patients that have upper extremity problems and pathology. Today is all about the wrist. So I'm going to share a couple of kind of what I foresee as clinical pearls because they truly really helped me with diagnosing and evaluating people with wrist pain. So understanding what mechanisms are going on, what structures might be involved, because that assessment is so crucial. It's the foundation of your treatment planning. So you can give 1,000 exercises targeted towards the wrist, but if you don't really know what the underlying cause is, your interventions are probably not going to be all that successful. So I want to share one of the top tips that I have for assessing wrist pain, and just, so this is going to be just one sliver of that whole assessment, because wrist pain is a really multifaceted, complex, huge topic to cover, and I couldn't possibly do that in a short video. So we're just going to go over kind of one of my top tips that I think will be hopefully a really nice clinical pearl for you. So without further ado, let's get into this video. So just a little bit of backstory for you. When I was 4 years into my career as a hand therapist, so I went straight into the field of hand therapy from graduating OT school, and my first job that I was at was at kind of a private practice. It was very busy. We saw lots and lots of patients, very high volume, not a lot of mentorship. I had a little bit initially, but a lot of it was kind of self-learning, and we had a consultant that sort of would train us once in a while, but after the first year or so, it kind of whittled down in terms of mentorship, and so there came a point where I kind of had reached sort of my maximum growth, I felt, at that position. So when I ended up switching jobs, the current job that I work at, we have medbridge subscriptions provided through the company, which is so awesome. I cannot stress enough how truly I love medbridge. I know that I am an affiliate for them, of course, and so take that as a disclaimer, but I genuinely would have them either way. I'm really happy that my company actually does pay for me to have medbridge through where my workplace is, but I honestly think it has some of the best continuing education for hand therapists out there, all in one place. And I wish that I had had it my early years of my career. I just didn't even know it was a thing. But one of the videos that I watched probably the first year or the second year that I was at this new job was a awesome video on classifying wrist pain. Let me look up the exact title for you guys and the author. The course is called Clinical Examination of the Wrist, a Guide to Classifying Wrist Pain, and the course instructor is Jamie Bergner, which she's a really great instructor. She has a few different courses actually on medbridge, but this one was really well put together, and it was so simple in the way that she presents it that it will make so much sense to you. I would highly encourage all of you to watch that video, and there's so many other medbridge videos that I can recommend for you, and feel free to drop your favorites in the comments, or if you have ideas for if you want me to suggest some of my top favorites, let me know below. I'm happy to provide that for you. But this course is a really great one. It goes through a really comprehensive style of assessment of the wrist, and it will teach you, I think, a lot. I am ashamed to say that my wrist evaluations were absolute trash before this video and others came into play, so I do feel like it's a really helpful video. One of the main takeaways that I found from this video that I had not learned anywhere else in 4 to 5 years of practice as a hand therapist was that you can do resistive versus stretch testing for the wrist, and that can tell you the difference between, is it a tendon involved or is it a sheath involved. So in layman's terms, essentially, is it tendinitis versus is it more of a tenosynovitis? And that can really help to guide not only your exercise prescription, but also in terms of activity modification, what modalities might be helpful, self-care strategies and techniques. A lot of these things can guide your intervention. So I do think it's really important to think about. So when we think about either a resisted test versus a stretch test, the resisted tests, if you get a positive result in the area where the tendon is located or localized, it is going to indicate that there is probably a tendon injury in that area. Now, if the stretch test is positive in the area of the local tissue that you're testing, then it is more likely that it is a tenosynovitis, a sheath that is affected. So let's walk through sort of an example of how you would test that and what that means. So I'm going to use kind of a simple basic muscle group that we would often test for wrist pain, especially if somebody comes in, they're complaining of dorsal wrist pain. Either it's going to be on maybe potentially the radial side or the ulnar side. Sometimes it can be central too. That's a sort of a different can of worms. But let's sort of think about, let's say this patient comes in and they have complaints of pain sort of localized in this region, so more on the radial side of the dorsal wrist. Now, you've probably already ruled out, scaphoid injury, there's a lot of other potential comments and diagnoses that could be going on here, but let's say we've ruled sort of all those other things out, and now we're going to test, do we think this is tendon issue or tendon sheath issue? So for the muscles on that side, we know that we have ECRL and ECRB, which are the muscles that attach at the lateral epicondyle. They come down and come through sort of the second dorsal compartment area. So to test those in a resistive fashion, you're going to have the patient with their arm pre-positioned in elbow extension, forearm pronation. I like to have them make a loose fist so that their finger extensors are not taking over the motion. So kind of in this position. And then for a resistive position, so the therapist is going to be in obviously better alignment for this. They're going to create resistance against that pressure. So when we think about what motion ECR, L, and B does, it's a combination of wrist extension and radial deviation. So to resist that, we want to think about pushing the wrist towards ulnar deviation and flexion, right? It's the exact opposite direction. So a resistive test here in that position where the therapist is placing resistance against, if the patient says, ow, the therapist is going to say where, right? That's very important, because if you have them resist and they say pain, but it was here, that's not a positive test, right? But let's say they say ow, and you say, where did that hurt you? And they say right here, right in that area of pain. It's a positive test. That means that it is probably a tendonitis or tendinopathy in that area. Now, let's say that you want to do a stretch test to test sort of the tendon sheath in that area for more of a tenosynovitis. So now we want to think about putting the ECRL and B on stretch as much as possible. So that, again, we're going to this time have the patient relax in that pre-positioned place. And then you're going to bring them into a passive stretch towards wrist flexion and ulnar deviation. That's going to be the maximum tension for that muscle. And a positive test would be when the patient says, ow, and you say where, and they point right here. So that would indicate that it's more of a tendon sheath issue going on, or a synovitis type of injury versus a tendinopathy. So I don't know about you guys, like that for me was mind-blowing. It changed the game for me for wrist evals. It helped me to really have one tool, a clinical tool that was easy to remember. A lot of the special tests, they are important, but they are sort of a pain in the butt to remember, all of them, while you're in front of a patient and while you're trying to grow and especially as a new therapist, right? Like it's impossible to memorize all that stuff at once. So to me, this was like a really easy clinical test. I could test for the flexor muscles, I could test for the extensor muscles, I could tease out the difference between the, ulnar versus radial side of the muscles. Like it really made a huge difference for me for my treatment planning and my assessment in wrist pain patients. So I really liked that that type of clinical testing, and I thought this MedBridge video actually highlighted it so well. I really appreciate that. As I was preparing for this video, I kind of was like looking back in the slides, and there's actually so much good information in them. The way that the course is presented, they'll go through kind of the risk testing, and then they actually go through the clinical reasoning and decision-making skills. They have some really nice little flow charts of like, if this is positive, what does it mean? If the pain is, again, like if you do that test and the pain is volar, what does that mean? If you're stretching them and the pain is volar versus dorsal, what does that mean? So it actually had a really nice structure and easy to follow, and the course slides are super nice and helpful. Which again, because I am a subscriber of MedBridge, I have access to that even, 3 or 4 years after I've taken this course. So I can look back anytime. Just one of the more reasons why I think MedBridge is just freaking awesome. But yeah, so that's kind of like my wrist assessment clinical pearl for today, is doing the difference between resistive versus stretch testing to help you determine, is this more of a tendon issue or more of a sheath issue? I know this video was rambly, and hopefully it made sense. Hopefully it helped some of you out there. If it did, give this video a thumbs up. Don't forget to subscribe to the channel. I look forward to making more clinical pearl videos about wrist assessment and many other things soon. We'll talk to you in the next one.